Happy Sunday, everyone. It's me, Tisha Rowe. If you're new to my page, I am a family medicine physician here in Houston, Texas, and the founder of Rodocs. And I wanted to come on today to talk about colon cancer. And of course, I can't do that without saying rest in peace to Chadwick Boseman, because he was such a positive influence on our entire generation. I sat in my car yesterday on my way to my Target run, and there was this video. I can't remember if it was Jimmy Fallon or Saturday Night Live, but they recorded where people were saying what Black Panther meant to them. And I started crying, and I'm not a crying type of person. I don't cry often, but it was so impactful because, especially for me as a single mom, like having positive Black male role models out there that I can show my son is so important, and I know that he will be that for generations to come. So I just had to say rest in peace before I go into my health topic, because he really made a huge impact on our generation, and just he will be missed. So now to colon cancer. Now, we live in the generation of WebMD, and I am big on not just regurgitating information that you can find anywhere. So if I do a health talk, my goal is really to give you information, but also to present to you things that you may not have thought of or heard elsewhere. So when it comes to colon cancer, being a family medicine physician, I do physicals. That is a large part of my job. Coming in where I do a head to toe exam, I do your blood work, and I am looking for the things that you may not see, and then listening to all of your complaints and trying to help you resolve them. That is my job. I see people for sick things too, but I really love primary care. I love what I do. I consider myself a problem solver, and I have diagnosed multiple patients with cancer. The youngest patient I've diagnosed with cancer was in her 20s, right before she got married. I was still a resident. I've diagnosed people with advanced cancer, growths coming out of their chests. I have diagnosed people with breast cancer. So this is what I do, okay? And I want to explain where I come in, and then where a specialist comes in when it comes to cancer. So the first thing that I know everyone's going to be going crazy looking up, what are the symptoms of cancer? Okay, so that's pretty easy. You can Google it and find colon cancer. It's your colon. That's how you digest your food. So many of the symptoms related will have to do with digestion. So things like constipation, diarrhea, abdominal pain, changes in your stool consistency, black stool, blood in the stool. All of those things could be cancer. But guess what, guys? It could be a lot of other things. And that's where your doctor comes in. Most people who come in to see me with blood in the stool, it is going to be hemorrhoids. So do not assume I have blood in the stool, I have cancer. When your body processes blood, it actually comes out black. So usually when you see blood in your stool, it's like coming out at the very end after everything has already been digested, which is why we don't usually panic because you have blood in your stool, okay? Abdominal pain can be from what you ate. It could be anxiety, irritable bowel syndrome, so many other things. Diarrhea could be Crohn's disease or some other chronic GI problem. So I'm saying that to say, just because you have symptoms doesn't mean you have cancer. And what I find more often than not in the people that I've diagnosed with cancer is a lot of times cancer starts showing symptoms when it becomes obstructive, and at that point it's grown a lot. So my goal as a doctor is I want to find these things before you even start having symptoms. So you may say, well, how are you going to find it if I'm not having symptoms? One of the ways, I'll talk about now the ways that we diagnose cancer. And this applies to many different cancers, not just colon cancer. So one is doing blood work. So you may think that blood work is not necessary. And I know this because I meet people all the time. On Friday, I met a guy who came in for a COVID test, and I said, when was your last physical? He said 5 years ago. I was like, bruh, you need to come see me, you know? And I meet people, especially young people, all the time, that's their attitude. I'm healthy, I'm walking around, I feel good, I try to eat right, I exercise occasionally, I don't need blood work. What would we see in your blood work that may indicate that there is a bigger issue when it comes to colon cancer? Anemia. Because when you have cancer in your colon, some people may be losing blood through their colon and not realizing it, again, because it's coming out not as blood but as a blacker stool. But their blood levels, their hemoglobin will start to drop. When we see that, depending on certain numbers, iron levels, we can tell, is it coming from the colon or other reasons for blood loss? So blood work, very important. Where a lot of my patients get stuck and don't want to get checked, especially older patients, is a rectal exam. When we do a rectal exam, what are we doing? Getting a stool sample that we can send to a lab to check for blood that you cannot see. Okay, now I get it. A lot of people have reservations about someone putting their finger in your butt. Some people have no reservations about a finger in their butt. Whatever your case may be, if it can save your life, hey, this is a time, man up, woman up, and you have to take that finger. If you absolutely cannot stomach the thought of that, or you think it's going to just be extremely painful, then your next option is to go home and do your own stool sample, where we'll give you a little card and you put the samples of your stool there yourself and bring it back to the doctor or send it directly to the lab. Okay, so that's two ways. So we talked about blood work. The doctor does a rectal exam, looking for a stool sample, but also feeling if we feel anything abnormal in there, but that's a very small portion of your colon. And then the other thing is sending you for a colonoscopy, which is the best thing we can do, right? I cannot tell you in my years as a physician how many people come to me year after year after year. I write an order for them to go see a GI doctor, colon specialist, to get that colonoscopy, and they never go. Talk to your family members 45 and up, and if they should be going to get a colonoscopy and you love them and you care about them, go to them with that appointment. I, as a part of my residency, had to shadow Dr. Hughes, one of our GI doctors at the time, and it is a painless procedure, guys. Even though you're not completely sedated, they give you like the same kind of gases they give like when you go to the dentist. Most people don't remember they even had a colonoscopy done. So there are people out here who are refusing to get a test that they literally are not going to remember that could save their life. If it's not you and it's someone you love, talk to your family members. As we know now, Chadwick Boseman was 39 when he was diagnosed. I usually don't send people to get colonoscopies until 50 or 45, depending on their risk factors, right? So he was well below the age, which means listen to your body, get regular checkups, and if you have any concerns, get it done, get it checked out, okay? When someone has cancer, it's a normal cell multiplying over and over and over in the body. And we also now know that he was diagnosed at stage 3. Stage 1 means the cancer is localized, means it's in that one place and it has not moved yet, okay? Undiagnosed and unchecked, cancer is going to move. Thank you so much, Brian. Thanks for listening, and everyone, thank you for supporting. And if you find it helpful, please share. But it's localized. It hasn't moved. That means we have time. That means if we catch it early, clip, take it out. There's some organs like your pancreas where it's not that simple, but colon, normally they can snip that cancer out if it is caught early, right? And so now stage 2 means that it started to spread, like it's becoming invasive. It's not just like on top of the wall of the colon. It's going to go into the wall of the colon. And I'm simplifying this because oncologists look at multiple factors, but this is a simplified idea of what stage 1, 2, and 3 mean. Now, stage 3 usually is starting to spread at least into the lymph nodes, right? Lymph nodes are like the cleaning system of your body. So now, if your lymph node sees cancer, it's thinking, this is not a part of the body. Let me take it out. So that's why breast cancer, they get swollen nodes here. Colon cancer, the lymph nodes are not going to be visible outside the body. So the cancer is spreading and you have no idea. It's not like the breast where you'll see the tumor sticking out sometimes. They feel lumps. You're not going to feel it. So if you're not getting checked out, you won't realize it. Stage 4, it has spread to other organs, right? So sometimes we'll have people come in with shortness of breath and we do an x-ray and we see they have different spots in their lungs. We don't assume it's lung cancer because that cancer could have come somewhere else and gone to the lungs. Or someone comes to see me for a physical, I check their blood work, their liver enzymes are elevated, they don't drink alcohol, they don't use a lot of Tylenol. My first thing is, let's get some additional imaging, let's see what's going on, because if there's no other source for this abnormal liver function, it could be cancer spreading to the liver, okay? Someone may come into a headache with a headache because the undiagnosed cancer has spread to their brain. They may come in with bone pain because the undiagnosed cancer has spread to their bones. We want to catch you before that point. No matter what stage you are, he had stage 3 cancer and he lived 4 years. I know people diagnosed with stage 4 cancer who have lived more than 4 years. People I know personally. So do not be discouraged by the stage you're in because it still can be treatable. So let's talk about treatment. Earlier I said if we catch it early, you can cut it out. Whether you catch it early or not, usually in cancer, there are 3 types of treatment. There's radiation, surgery, and chemotherapy. With the sensitivity of the bowels, I'm going to have to defer to my oncologists and GI friends. I do not think you can radiate the colon, but you definitely can do chemotherapy. The problem with chemotherapy, because it's later, when you are attacking the cancer cells, you are also attacking all of your body indirectly, and not necessarily attacking, but you're going to have side effects like the throwing up, the hair loss. Depending on the type of chemotherapy, that will be, the side effects you get. But the point is, don't be so afraid of the diagnosis that you don't go and get it checked out, because when you get diagnosed can make the difference in the length of your life from that point on. So I would just encourage, this is something that, is a tragedy for us just as a people, to have lost such a brilliant soul. But in my faith, I believe that, like many have said, he's in heaven, he's with the ancestors, he fulfilled his purpose on earth. And that is the blessing in all of this. And I hope, if nothing else, beyond all the other great things that we got from this beautiful soul and beautiful human being, is that it saves someone else's life who has been neglecting their health, who's been having maybe symptoms and scared, not going to the doctor, to realize that you've put off your health too long and it's time for you to take better care of yourself. It's time for you to get regular checkups. And that includes my physician friends too, because believe it or not, too often we're so busy taking care of you that we completely leave our own health on the back burner. So I am my sister's keeper, I'm my brother's keeper. So docs, time for you to schedule your checkup, just as we are educating and telling everyone else to do the same. If you have any questions, feel free to leave them in the comments. I'm going to post this on YouTube. So if you're on YouTube, even if you don't have a question, drop a comment. Let me know if you found the information helpful. And if you found it helpful, definitely share. You never know how you may help save someone just because they've been thinking they need to do this. They need to take charge of their health and putting it off. And you sharing this may make the difference in them doing that or sitting around for another year and having a bad outcome. So just to summarize, you may not have symptoms for cancer until it's late. So get your annual checkups. There are multiple ways your doctors can look for it, from blood work to stool samples, rectal exam, getting a colonoscopy. Talk to your doctor about any symptoms you're having. Don't freak out. And if it is the worst case scenario, medicine has a lot of advances and there's a lot that we can do. So thank you all for tuning in. Have a very blessed Sunday, and I'll be back on soon with another health topic. And just, again, rest in peace, chat. Have a great day, everyone.